It's a really crippling pain. It feels like somebody's like hammering my joints. I can't even describe. It's just the worst pain I've ever experienced in my life.
If I do too much active work, my body tends to get really tired. My legs start to hurt. I can't walk very far.
I've heard stories about people coming to hospital and being told that, oh, you're not in pain, you just want the pain medication.
Living with sickle cell disease can mean regular blood exchange transfusions, transplants, joint replacements, and as we've heard, indescribable pain.
So people speak of grinding bones, breaking bones, this sort of level. I have patients who had a broken wrist for a week and couldn't distinguish it from sickle pain, or walked on a broken fibula for a month. This is the degree of pain they're in.
Sickle cell disease is an incurable genetic illness causing red blood cells to take a distinct crescent shape, which can block blood vessels and affect the way oxygen is carried around the body. This can cause problems including delayed growth, organ failure and chronic pain known as sickle cell crises.
Adagvio is the only targeted treatment for the prevention of recurrent vaso-occlusive crises.
Until now, there's been little in the way of treatments, but late last year, the National Institute for Health and Care Excellence approved cruzenlizumab under a managed access agreement. That means for the next 3 years, about a third of the 15,000 sickle cell patients could be treated. And this month, the first of them in England will learn if they're eligible.
We will offer this drug to our most severely affected sickle cell patients, those with frequent crisis who may be in need of additional support, and because we have to see them at least monthly, long term, this gives us a chance to make sure the supportive care is up to date and we can do targeted interventions.
And that is important. Too often sickle cell patients feel let down by the health service, their pain left untreated or simply not understood. So some will avoid hospital even if they are having a crisis. And there have been high-profile deaths. In 2019, Evan Smith died after staff failed to treat his sickle cell crisis. 12-year-old Victoria Olabodi died in the same year in similar circumstances. What those like Dr. Besser hope is that the new treatment will help these patients re-engage because they will need to come to hospital. The new treatment, cruzenlizumab, is given through a drip once a month, clearing blockages so the cells can move oxygen around the body and hopefully reduce painful crises. We are at Addenbrooke's Hospital in Cambridge, where they led the trials for cruzenlizumab. Waiting to hear if she's eligible is Elaine Tappan, receiving her fortnightly blood transfusion.
I'll put the fluids up and I'll get the blood out of the fridge, okay?
The 57-year-old had a severe crisis last April that could have killed her, and she's been admitted several times over the year.
I'd had a chest crisis. Well, you never want to have a crisis anyway, but you don't want to have a chest crisis because that means that there's sickle in your lungs, and that's what makes it so fatal.
She's also developed antibodies against the donated blood, so she can only have a small exchange each time, always with the fear more antibodies will develop.
Options for me are very, very slim. A new drug, I welcome a new drug. For sickle cell people, we don't have much choice at all to help us.
I've had 2 of my hips replaced. I've had 1 ankle fused. I've had laser treatment to the back of my eye. I have hyperthyroidism, so on the waiting list to have that removed. Back is going, elbows going. When I say going, so there's some degeneration to I think I have a disc bulge, and I have degeneration in both elbows, the left one being the most problematic.
The destruction caused by sickle cell, yet Toxo Dasanmi describes herself as managing the disease. So she's not actually certain she would qualify for the treatment because she hasn't had a crisis for several years.
For the NHS to be asking me that I have to be sick enough, the fact that I have sickle cell is not enough. I have to have certain number of crises. I will think that the idea of, getting on the drug is to get better, not to get worse before you get better. You wouldn't ask that of a cancer patient. You wouldn't say, oh, let's wait for the tumor to grow or spread before we start treatment.
And you presumably don't want to have a crisis?
No, I wouldn't come off, blood transfusion to be sick just to get onto the new drug, no.
having her blood transfusion as she does every 5 weeks. Sickle cell caused 25-year-old Nswana Katuka to have a stroke when she was just 4 years old, and that means she's not eligible for the new treatment.
Sickle cell, it will be part of me. It will always be part of my life, whether there is a cure or not. I don't think I'll ever get rid of it completely. If there is a cure at some point, then I'm happy to have it done. But sickle cell is what I know, and sickle cell is what I have always known.
And this treatment isn't a cure, but after years of neglect, at least there is a new drug and there are more in the pipeline. And that means that for the first time in a long time, there is hope for those living with this debilitating condition.